Bipolar 1, and generally the criteria for the high is that it's so bad the person was hospitalized or should have been. And sometimes they're delusional. They get very grandiose ideas and believe they're going to run for senator next month, or believe that they're the Messiah or something. And these are people who were perfectly normal a few months before, but now in this mania, they have some really extreme ideas. Now, those people classically do well with lithium. And often their history is that they have a manic episode and then maybe a depression after it. And then they might have a long period of a year or more on no medicine and do fine and be absolutely normal. And then they have the next episode. After the first episode, some people go even 4, 5, 6 years before the second episode. But after the second episode, then I really put my foot down and say you have to be on medicine, because now they're going to have an episode every year or two unless something prophylactic is being used. The symptoms of milder bipolar disorder are sometimes hard to find. And Robert Post at the National Institute of Health a long time ago had a number of patients that came in to be treated for depression in the hospital. And one of his friends said to him, "Do you mind if I interview the relatives of your patient while he comes in?" And because I'm doing some research on the genetics of depression and so on. So his friend interviewed the relatives and found out that maybe 50% of them reported the patient as having bipolar disorder, of having had some highs, which is a history that Dr. Post and other people doing the research didn't get from the patient. Because if you're having relatively mild highs, you don't really see it as abnormal. You're talking a little faster, you're exuberant, you're getting a lot of things done, and it might be very productive. Sometimes it's a little too productive, and sometimes you do things a little overboard. Take on too many projects, spend a little too much money, talk too much, get into too many arguments. And even then, the patient, in retrospect, may not see it as an abnormal period. So it's very important to get the symptoms and history from the relatives. And too often, what we've done in the past is we didn't ask even the patient, have you had periods where you were more productive than usual, you didn't need much sleep at all, but you had more energy than ever, and this would go on for a few weeks while you're working on some project. We didn't ask all those questions. We were waiting for a patient to come in who had the obvious template of bipolar 1 disorder, manic depression, that they are talking a mile a minute, and they've got grandiose ideas, and they just went out and bought 2 Jaguars because they are starting 3 businesses, and they know they'll be wealthy in 6 months, and their wife is a little angry about this expense. So then you see that and you say, that's bipolar disorder. But there's a lot of bipolar disorder that's much milder than that, and that's what we have to look for. One of the first people I ever treated for bipolar disorder was in the early 80s. And he was a 6'4", 280-pound Orthodox man who I actually met on the street in my neighborhood. And when he found out I was a psychiatrist, he wanted to come see me later. Now, he had been cycling for years between highs and lows, and he'd have long depressions, then he'd have mild highs where he'd get very exuberant and get a lot of work done, but the highs became a little troublesome too when he was in his 50s, that he was on disability, and he was cycling all the time from depressions where he felt really miserable to highs that were somewhat agitated and unpleasant. He was cycling every few weeks. And I tried him on a number of medicines, and everything he took, he had a lot of side effects. And if you gave him anything that had an antidepressant effect, it would lift his mood up for hours and then crash all in one day. So the only thing that he could tolerate was 500 milligrams of Depakote. And I called up a friend of mine, and a psychiatrist who was older than me, and I said, what should I do? And he says, just leave him on Depakote. Don't give him anything else, and maybe in 10 months he'll be a lot better. So this fellow could only tolerate Depakote 250 twice a day. If I gave it all at night, he'd be too sedated. For somebody 285 pounds, a dose of 1,500 or 2,000 would seem more appropriate. But we just kept him there. And over the next few months, his depressions became less and less, and he saw me less and less often. And then he came in one day and he said, the depressions are gone. I'm having no more problems. And I looked at the chart, and it was exactly 10 months, which I had never mentioned to the patient, and my friend had just said this sort of offhand. But for the rest of his life, he just stayed on that 500 milligrams and did fine. And it was really quite remarkable. And then a new anticonvulsant came out that I started using in 1996. And I think it was about 6 years later it got approved for depression. And that's Lamictal or lamotrigine. And this antidepressant has a great benefit for depression. It's purely an antidepressant, brings people out of depression, and seems to have little or no benefit for the highs. But most people with bipolar disorder, as their main problem, have depression. And the depressions last usually 3 times as long as a high. And as one gets older, there's less and less highs and more depressions. So the lamotrigine turned out to be a really ideal medicine because it gives no weight gain, no sexual dysfunction, and you generally don't have any sedation on it. And it also works at a relatively low dose. For seizure disorders, you want a level between 5 and 20 nanograms per milliliter. But for depression, it often works just at a level of 2 to 3. So you're certainly not getting many side effects. And so people feel fine on it. If they stop it, they don't feel any different. They don't feel, oh, wait a minute, suddenly I'm a little less sedated, or suddenly I realized that I was having dry mouth with that medicine.